Hey guys, welcome to my YouTube channel. This is Jay Patel and I am a certified physician assistant here at MyFitMed. Here I cover multiple topics to improve your overall health and fitness, and the topics may include hormones, vitamins, weight loss, and overall lifestyle changes. The goal is not to treat you but to educate you to help you get in the best shape of your life. Enjoy the video.
So October is the Breast Cancer Awareness Month. Today I am going to discuss about the importance of getting a regular breast exam and mammogram for female patients. All women age 40 and older should get a regular breast exam from their OBGYN or PCP and a yearly mammogram. 1 in 6 breast cancer occurs in women age 40 to 49. So early detection is the key here. If the cancer is detected early in the stage and if it hasn't spread to other areas like lymph node and other body part, then the 5-year survival rate is almost 99%. So regular screening and yearly mammogram can lower the risk of dying from breast cancer by almost 40%. Along with exam from your primary care and yearly mammogram, all females should also do a self-exam at home and look for the warning signs. Some of the warning signs that you should be looking for are new lump in breast or armpit area, nipple discharge other than the breast milk, dimpling of breast skin, pulling of the nipples, pain in nipple area or any area of the breast, any change in the size or shape of the breast, or any other unusual changes that you see in your breast. You should always contact your OBGYN and talk to them and see if this is normal or not normal and if you need a further testing. So females, be aware, and like I said, early detection is key. So keep up with the regular testing and yearly mammogram.
Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.